people in the room and online wish they had more resources when COVID started to help mitigate. Like, we know there's been disasters before COVID, but thinking back, how many people wish you had more resources that were available? Raise them hands. Let me see them hand raises online. I need some reactions. Say yes in the chat box. Let me get some hallelujahs, so that's the first thing, right? We all wish we had those resources, right? Like, we know there's been thunderstorms. We know that we have had disasters, but it was something about COVID. It took everyone out of that safe zone, out of that safe environment, and those lesson plans and those tabletops and those exercises that we have done with FEMA, with our own tribal health departments. So with that question, now so this last session is a session that you all said we need at the last institute. You said, Dree, it was good, but I didn't get to talk. And then you said, Dree, we need more lessons learned. What can we do to prepare for next time? So that's what we're going to do with this session. This session is a dialogue. We're going to bounce back. We have Mr. Pearson here. He's an emergency manager. I know a lot of other people are emergency managers online and in person. So today is all about dialogue, peer learning, one-on-one peer learning. We're going to talk about a topic that you all have raised to us doing webinars, and we're going to have Mr. Pearson lead the conversation. And then we want you to talk about what those resources have been for you, what has worked, and what do you need more of, so that we can structure future trainings on what you need more of. So with the sign of a hand raised and a chat yes or yes verbally, are we all on the same page? I couldn't see the hand raises online. I couldn't see the text online. I heard the voices in the room. Oh, there I go. I see my hand raises now. So we're going to turn it over to Mr. Pearson. Just stop.
COVID, we went into a lockdown in 2020, May of 2020, and that was kind of the beginning of the process to what we resurrected as what we call our DARE team. We got that from a ice storm that happened in 2018, and our DARE stands for Disaster Assistance Response Employee. Those are the ones that the last speaker talked about as far as pulling a whole bunch of people together with different assets, different resources, and how we dealt with COVID when it happened. During that lockdown, what we did do was we used exclusively the ICS structure, where we had operations, logistics, planning, and different things like that to help with the process. I got a good friend up in Eagle Butte, Harold Tiger, and he calls them flops for finance, logistics, operations, and planning. We're convinced the DARE is a little bit better acronym for things. So with that, one of the things that we first encountered was we didn't have any resources. We did not resource any PPE, things like that to help with the process. In fact, the only personal protective equipment we had was located in a point of dispensing trailer that we used for pod vaccine, for the pod points of distribution. We use that for the flu vaccines. As we get toward more of the endemic that we think we're getting toward, maybe that pod structure can be utilized to help us with, we need to continue to do COVID vaccinations. So some of the challenges that we had were just that, the PPE, and how did we find somebody that was in, from our testing, who was positive, and how did we transport that person safely with staff? We found that we needed to do congregate sheltering or non-congregate sheltering, and to isolate people within our properties that we had, which were the I-29 motel, which we used the east wing of that. The casinos were shut down. We used the two of those as additional resources for non-congregate sheltering as well, and that was a great resource. So housing really didn't come into play like they did with the last presenter, but we did have those ways to transport, and we needed those ways to transport people to those facilities. Staff safety was obviously a major concern. We had a staff of 26 people at the height of that lockdown, and we've gotten that down to maybe half of that as far as staff right now. Other challenges that we had, I don't know if anybody else experienced that, but we also have a dialysis unit that comes up from Watertown, which is called Prairie Lakes Hospital. And the issue comes about when we have a positive dialysis patient, how we transport them, how do we get them services, transport them safely along with our staffing. The other thing with what we call our CHR, Community Health Resources, we get into a situation where we have a blizzard, a serious weather event, they do not transport. That burden then falls upon emergency management, our law enforcement people to then transport COVID people, dialysis patients to get to their 3 times a week run. So I guess if we could stop right there, I just want to ask anybody if there's some questions that you have with getting resources. What did you look to? We looked a lot to our VOAD, our volunteer organizations that aid in disaster. I'll start naming some of them, but I don't want to run the risk of missing anybody. But PWNA has just been a great resource for us. We've gotten a lot of personal protective equipment from them. They, I think they're based out of Albuquerque, New Mexico, but have right here in Rapid City their satellite office here. What a great resource they've been, not just with PPE, but with food distribution. And maybe before we go on to some questions, I want to touch on, we did do a food distribution to families as they had to isolate. We serviced, during the height of that pandemic, around 1,700 families. Spent roughly $1 million+ in food, transportation costs, staffing, or whatever it took. So those are some of the resources that we had. If you had a large extended family, you please go ahead.
Oh, I waited till the end of your sentence.
I'm sorry, that's okay. No worries. Thank you.
I was just wondering,
So the question was, how did we distribute that food? And we used our DARE team, the Disaster Assistance Response Employees. Those people had access to vehicles. They were going 24/7 pretty much trying to get the food distributed to families and the extended families that we had there. if you were a larger family of 7, 12, whatever was a larger family or extended, they got 2 distributions per week. Smaller families, maybe just one per week. And that was everything that they put down as a checklist is what they needed, whether it was infant supplies, to whatever. We helped make that distribution happen. Cost per family per week probably started out about $150. And that pretty much doubled as we got well into the disaster. So the cost to do that was quite a bit. Because we called our people that help the disaster assistance response employees and not volunteers, we were able to document, track. We used a credentialing system very similar to this, which tracks people, the hours that you work. We also use timesheets, but that also helped us with the equipment that we used. We can credential a vehicle, we can credential our mobile command center, things that are FEMA cost coded and help with reimbursement. So we're very fortunate. We've submitted about 5 project worksheets since this all started. I think we're just in excess of north of about 1.4 million of reimbursements. We have another huge project worksheet that we're putting in now that we think will be around 300,000, and that will get us, like we think, to for now we're in this endemic stage. So our DARE team is what really was significant in helping get a more of a comfort level to people getting food distributed. When we were locked down, they wouldn't. It was just that you were locked down, except if you could get food, medical, and do banking. Pretty much that was the 3 things that they allowed. And for some that was difficult. We had to block off some roads. People would get out, escaped out the back door. But for the most part, people were very cooperative.
We have a question in the chat.
Sure.
How is your vaccination rate now?
Oh my. I don't know the vaccination rate, but at the start, it wasn't very good until we incentivized the vaccination. $500, I think, was the incentive to do that. And that really increased the rate. So I'd be guessing if I tried to give you a rate of what our vaccination rate is. But it improved significantly once we did the incentive.
So at this time, this is where the engagement happens, right? So we're talking about right now resources. So by raising a hand in the chat box, how many people use the same resources that Mr. Pearson just talked about? Or also in person, how many people have used those same No? Would you like to share what different resources that you use?
The Wahpeton Tribe was funded by the CARES Act, as I'm sure many other tribes were. The Wahpeton Tribe was funded by the CARES Act that was passed in 2020. So with that CARES Act dollars, we were able to purchase PP&E, the emergency management program. Began with a COVID task force, and that consisted of doctors, nurses, program directors, anyone that's involved in the emergency response. And they did events per community, they did testing, they did vaccinations. They started a health authority to monitor and track the COVID testing, the positives, the negatives, the hospitalizations, the deaths. So it was very impressive, and it's still active today, and I don't think that they've slowed down because there's so much fluctuations. There's an ebb and flow of the positives, so we're kind of like in a red area now again. 2 weeks ago we were in the yellow, and then before that we were in the green. But another thing that happened with the tribe was they passed laws. They passed shelter-in-place laws, they passed masking laws, they passed a law where you have to have a COVID vaccination to be in employment of the tribe. And also they had isolation tents, they had campers. The 2 levels of funding, there was families first, so you could get supplies, all that type of thing, cleaning, they delivered food, they had people at the casino. It was just an all-out effort. So there was like 55 tribal programs, and the ones that could help and have the resources, everybody worked. Yeah.
Would you like to add to that, Ms. Jean?
Our tribe also has that, and they also have a team, which has all the leadership and a nurse. And their task was just to bring those positive cases, Gatorade, medications to help them feel better, and that's it.
Okay.
You know, but we did use the CARES Act. We also have built 10 little isolation houses, the little houses, also during that time. So
here's an example of the COVID testing that they do on a daily basis.
Flip it
Where's your camera?
right there.
okay, back it up.
And back it up just a little bit at an angle.
So that tells us how many were tested that day, how many are positive in each community, how many were negative. But it's really effective, and we did this on a daily basis, so it's very helpful for everyone.
Anyone else?
I've got a question about how you're tracking your information. What kind of system are you using?
They have contact tracers who, when there's a positive test, then they'll go to that family and then they'll track where they were, who they talked to. And in the very beginning, we had border monitors. So there was people, we couldn't leave the reservation unless it was shopping or food and that kind of thing. And then in 2021, that ended. Yeah, that ended. So it was effective, and the only thing was that they didn't have really good shelters for them to sit in the hot sun and in the cold. So they had wood stoves, and there was the other reservation in South Dakota also did the same thing, and one of them was Grand River, and they had a conflict with the governor of the state because she wanted them to close their border monitors, but they wouldn't do it. So people had to just go around the reservation.
Oh, that did take a lot of collaboration.
Yeah,
that explains that.
Do we have any feedback for anyone online? Are you all catching this online? Okay, I got it, yes. So the next topic that we received a jury talk about pods. So now let's talk about pods. So Mr. Pearson, he touched on how they utilized their pods to get food out into the communities when they was on lockdowns and no one was allowed to leave the boundary. So my question would be, how have you utilized pods in your COVID response activity? Have anyone used them for vaccine clinics? Have anyone used them to get, clothing or their food supplies out? How have you utilized your pods?
Well, ours function along with the DARE team to do those points of distribution. Additionally, our pod structure also follows the instant command. We did not have any department, I don't believe, that Sisseton-Wahpeton didn't participate in our twice-a-week meetings. We would meet on Monday, we'd meet every Friday. And those were very productive meetings. They were very well attended. Like the other speaker just happened from Nome, that they got to be quite lengthy to start with. Toward the end of the pandemic, they ended up being about half an hour long, if less sometimes. So yeah, I really appreciate OST, what you guys did down there. I couldn't even get Harold Tiger to get me through Eagle Butte, so that's how good that shutdown went up there. Any other questions from the group? Or? The staff that we had, they did have a 24/7 hotline that people could call into. Our staff really went over and above, doing what they needed to do from the DARE team. The stress that those folks are under, people calling barely able to breathe, crying. It was very, very stressful for our staffing. And they're to be commended for the great work that they did. The other thing that we additionally would provide would be phones for the people that were isolated. We have, like I said, we did use the casinos and the motel property that we own. Additionally, we now have a COVID center that has room for, 30 rooms in there to isolate people. At its capacity, we probably had at the most 14 people in there at one time, occupying different rooms. And that was mostly for elders, to keep them probably safe from other people in the extended family. And those were hard times, because when you were isolating for that long, it got to be tough. And but again, they're safe, great location, great facility, and we're grateful to have that and utilize that today. Yeah.
Okay, so the next topic of discussion is we're getting to like those investments. Like, we understand when you're addressing disasters or public health threats, it's important to be prepared in anything that you do in life. You know, if you're having a baby, you want to be prepared. If your kid is going to college, you want to be prepared. You know, if you're getting married, you want to be prepared. So when we had COVID, there was a lot of preparation that went into some communities. We had some communities, as soon as they heard anything, they jumped on it. They had a COVID response team. So the next question is, what benefits did your tribe or tribal organization experience from preparation and early execution for detecting, containing, and rapidly responding to and mitigating the spread of COVID-19? So now you can use that in the chat, and this is also open to anyone online. Mr. Pearson will start the conversation, but 100% tell us in the chat, what did you do? How did your tribe, how did your health department prepare for COVID? And what are you doing to prepare for the next surge, if possible? Because, you know, COVID is tricky, you know, like sometimes and then other times. So, like, how are you all preparing for those surges?
Initially, what we did was we utilized the casino in North Dakota to do our first mass vaccinations. That was a coordinated effort with the North Dakota Department of Health, and we did a mass vaccination as a drive-through up there. What was unique about North Dakota was they have a National Guard team. Those gentlemen came in, and you could tell they'd done that before, because it was just military, very systematic, very well done. I think a couple brains got stabbed during the process because they might have reached a little far for that, but they did what they had to do. In addition, we would then do at the casino in Sisseton, it's right off I-29, and we did a mass testing there as well. But we did that in conjunction with the South Dakota Department of Health, and that went really well. The testing results would get sent to, obviously, North Dakota, because we couldn't convince them to send them down to the lab in South Dakota in Pearson. And the results from North Dakota came back just a little bit quicker than they did from the South Dakota side. That got better as things moved forward. But that's how we initially went. We did the same thing then with our mass vaccinations. We would set up the casino in North Dakota and in Sisseton. The one in Sisseton, though, we actually had FEMA come up with a mobile trailer. I think that trailer went to all the reservations East River, and then I think it also went up to Eagle View as well. So that's how we tried to contain things. The testing, contact tracing was always an issue. We did have one person at the IHS that helped that with her team and did, I think, a remarkable job. If we would have improved anything, I wish we would have had more people contact tracing.
And in your opinion, Mr. Pearson, what investment and preparation has mattered the most in the pandemic? What would you say, as an emergency manager, what trainings, what resources
what partnerships have mattered the most?
A lot of times it comes down to training, because we encouraged all of our people to at least get the ICS classes, the 100, 200, and 800 done. Those that moved the thing forward and did the 300 and 400 classroom, those were just incredible. Those that took the initiative and do that. We encouraged all staff within the admin building to get the ICS classes done. If you are logistics within the ICS structure, you're tasked with that, and 4 months into the pandemic or the event, you're not really sure what you do as logistics, that ICS class, that structure really helps. We had a little trouble, a little pushback with the instant command structure to start with. People didn't really quite grasp why we needed that, because whenever there's an emergency, my number is on the Facebook page and they call me because that's their emergency. My emergency is I'm on propane. My emergency is whatever, anything that really wasn't related to the COVID crisis. So having people trained in the proper way, it was just the best thing that we could have done at the time. I hope that answered your question.
You mentioned ICS, Incident Command Center System?
Structure, I'm sorry.
Structure, okay, that's my question.
FEMA's Federal Emergency Management Agency is known for its acronyms, and I apologize for that. If there's something out there that's my favorite acronym is NTOA. It's kind of a protest against it stands for no two-letter acronyms. It's a four-letter acronym to say that.
That's a resource we didn't use.
And just out of curiosity, this is another hand raise for my attendees in person and another hand raise for those online. How many people know exactly how they would get in contact with their regional FEMA coordinator if their tribe had an emergency or a disaster? How many people know exactly how you would get into contact with FEMA?
And I'll inject that having worked part-time with them in community relations, I had the good fortune to know a gentleman named Ricky Stevenson, who was a FEMA, not a regional coordinator, but a great resource. Locally, we're very blessed to have Kathy Bach-Cooper, who is our tribal liaison with FEMA. Kathy, what do I do? Boom. She can help with that answer. She knows who to contact, what to do. Another part of that whole thing is, and I mentioned them before, is the partnership with Native Americans. That organization was a resource that we probably relied on too heavily. We need this, we need that. We would call them, not begging, but hoping that they had that resource for us. And I don't think that they've ever let us down. And if they didn't know where to get it, they would find it for us. And it's just amazing the work that we, the partnership that we have with them. That came about as a, if I could just digress a little bit, it came about as a chance meeting that I had with the director at that time, and evolved into some things they'd like us to attend, took us on as a partner, and grateful that did happen.
As for the training, anybody can go online and get that training. And anybody can get a FEMA student ID number to take that training. So, anybody who wants to build those resources can do that. And then once you show that you have a certain number of people in your community that have the 100, 200, 300, 400, or 100, 200, 700, and 800, you can show a need to bring a FEMA trainer in to do a 300 and 400.
Right. We have a Blue Cell is the name of the training company that comes out of Colorado that does our 300 class.
Right, but TEACS does it. There are plenty of other people who, and some, I actually know a couple who actually, a general a retired general in the Army who does it for free for certain communities.
Right. Texas A&M is TEACS, they're the ones who come up.
Right.
They also do our pod training. They've done continuity of operations planning. Continuity of operations is huge. Continuity is more than just you don't let the chairman and the vice chairman fly in the same plane together. You know, there's things that need to happen to make things function when things need to happen as they're supposed to.
And we would include those classes 100, 200, 700, and 800 in the resources following the Institute. For those that are unfamiliar with the courses, or some that may have taken 100 and 200, but you have not taken 700 and 800. So we will include those resources.
Yeah, the 300 and 400 are pretty much have to be classroom. I think they can do it outside of that, but most people taking that are in a classroom. The 400 is pretty dry.
Good explanation.
Good explanation. Thank you.
Although during COVID, they did do virtual.
Virtual. They did do virtual.
They did do virtual, and so they are, EMI is allowing still some virtual classes based on where you are.
And for my good friend down here at the end, the EMI stands for the Emergency Management Institute.
Yeah.
Another acronym.
And if you don't know that EMI, you can actually get a degree and certificate in emergency management by taking those courses and getting a student ID and taking a certain prescription of courses, transferring them for credit to the Frederick Community College, and you can get both a certificate in emergency management or an associate's degree in emergency management.
You just described it.
And I did the certificate from them. And so for folks who want to build that capacity, it's very easy to do that because all of Frederick Community College courses are online. So, you know, in one case, 4 courses from FEMA might translate into 1 course at Frederick Community College, but you can build those resources by using the FEMA courses that are online that are free, and then you can get funding to move those over to Frederick Community College for $25. It was $25, it might be $30 now per credit hour. Well, if any of you've gone to college lately, per credit hour is generally a lot more than $30 a credit hour. And you can move those to Frederick Community College. It takes about a week to get that done, and it's all done electronically. So you can build that very quickly, and you can build the capacity for emergency preparedness using just the FEMA courses online at your own pace, and then transfer them to Frederick Community College. And then EMI recognizes that as a degree, Emergency Management Institute.
So the cycle of an emergency is kind of like mitigation, preparedness, response, and recovery. So the more better prepared you are through those incident command classes, like you said, to be in the response mode, the better it is. The real problem happens is when we get overlapping disasters. We're in a response mode, a recovery mode with the endemic, and then now we get a disaster declaration because of a straight line derecho, whatever it would be. Those complicate things. And I'm going to say one more thing that complicated just a minor disaster, not to the people that it happened to, but a tribal member has a home fire, and now they're needing housing, and they are potentially a COVID positive and an extended family. So we had that happen about 7 times last year. Indeed, a disaster within a disaster. So those things happen. And that's just part of the process of what emergency management tries to accomplish. I tell people I'm a subject matter expert in nothing, but I know people. I know this gentleman here that can help me with something if I need his resource. I've got people at PWNA, I reach out to them. That's what we do. I know people that I know can help us.
But I don't know what the question is. Jeff, tell me.
So we have a question in the chat box. It was more of a statement. I finished the ICS courses up to ICS 2200, but was unaware I could transfer those over to the Frederick Community College. You want to talk about that?
I've done the 2200 as well. That, for anybody who doesn't know, is an extremely what's considered a mid-level management executive director of FEMA kind of course. During the pandemic, we were allowed to do it online, and I did it online in January of 2021. But yes, you can, and what I will do to help out for those who are unaware, because many people are unaware that you can actually do the FEMA courses, get credit, and then move them for a certificate in emergency management or a degree in emergency management. I will provide all that information and tell you exactly the steps, because nobody actually told me, and I fumbled around for 6 months. But I've told a couple of people, and they were able to get it done in lickety-split, like they had transferred. I told them on Monday, and they had the stuff transferred by the next Monday. So I'm more than happy to provide that information to Audrianna and get it disseminated for you guys and help you out, because yeah, it's worthwhile, because when people say, oh, you know, like I have to keep track of my hours because I'm part of the U.S. Coast Guard Auxiliary, and I have actually 2,490 hours. We go by 750 hours, so I get my next star at 2,500, which is why I know exactly how many hours I have. But I will be more than happy to provide that to Audrianna. And like I said, different organizations do it differently. U.S. Coast Guard Auxiliary, with what I do for them in public affairs, my training actually allowed me to get certified as a public affairs officer for them, as a, it's actually a position within, and I have the same training as a active duty Coast Guard person. But that's not usual if you don't have a background. So there's things you can do, and I'm willing to provide that for Audrianna.
And every year at our Fall Emergency Management Conference, we have the Civil Air Patrol at a booth, and they're a tremendous resource. We need something better than a drone. We need, you know.
Civil Air Patrol actually is doing an Air Force program called the AFAM, Air Force Aerial Mapping Program, with their members, and they can actually bring out an Air Force drone and map any area that you have for any emergency you have. And so if you don't have that information for the Civil Air Patrol, I can provide that as well.
You're just a great resource, just a great resource.
Yeah.
So getting back to some of the things with the COVID, is there anything in the chat that we want to look through or see if anybody has any more questions?
The last one was on me providing the information.
You can open it up though, open it up the chat. You can let them know you're open.
Oh, yeah, anybody out there, just please open up the chat room, or anybody in the room here, please let us know if there's other questions.
So we've had a lot of dialogue from in-person attendees. Now I would like some engagement for some of our online attendees. So do anyone online, you know, you have the floor right now. Does anyone online have any comments, have any resources that was helpful for them that they would like to share? Is anyone have any questions about how you all have utilized pods in your community, rather there was vaccination pods or food distribution pods or medical pods, for how you got, you know, PPE to your staff, training, what investments did you all have in preparing what tabletops that you all have performed or implemented within your emergency preparedness programs, and just what IT, right? So a big thing that I have learned that a lot of tribal communities invested in IT since COVID. A lot of tribes are doing more GIS, geospatial COVID tracking, so that they can identify those hotspots. Is anyone online aware of the work that their tribes have used with GIS? Can you all confirm that GIS mapping has been beneficial to you all? That's a question for online attendees, so I can get some engagement from you.
So in anticipation of some engagement, one other thing that I think with the ICS structure and the courses that one can take, kind of a very much overlooked position as a public information officer. Public information officers are key to getting the word out. We're fortunate at Sisseton-Wahpeton that we have our own tribal radio station. We have our own TV station that we can go into the local cable network. And with the public information officers out there, that's one way that we can get the message out. We can get the message out and repeat it and repeat it and repeat it, because people need to see things, hear things maybe 3 times to make it effective for them. I think that's been a huge asset there. One thing that another organization we reached out to was the Health and Human Service Agency. We were fortunate to get a $200,000 grant to help with the COVID, getting information out to the public. In addition to that, they helped us with home test kits. We were able to purchase 20,000 home test kits with that funding. The downside, as you know, with home test kits is how do you know who's showing a positive. We encourage them to anybody South Dakota here, if you watch the Pellland News, you'll see Sam Clemens on there. He's the public information officer with the City of Sioux Falls PD.
So I do not see any hand raises online or no new comments in the chat box.
Anybody? Viewer?
It's been a lot. I'm proud of everyone. It's been a great day of learning. Hopefully your minds are full, your bellies are full, that you're able to take one point back to your community, to your coworker, and say, hey, I attended the NIHB Institute and I learned blank. So we do not have any further questions from the chat box. I would like for us to give a round of applause to Mr. Pearson for his dialogue with us today. And you have some reactions, and I didn't even tell them. See? We family, y'all got it. And now we're gonna have some more reactions from our online crowd. And so I thank you all for joining us today. This does conclude day 1 of the Infectious Disease and Emergency Preparedness Institute. We appreciate all of you that attended.